Yes, I mean, I'll just add that I am not advocating outsourcing, but I think there's going to be a lot of pressure, possibly in some cases, for example, in local authorities with elected members wanting market testing, demanding it, and really you may find in some cases that you are forced to outsource, and I'm just saying that if you do, there are ways of doing it well.
I think another point I would like to make perhaps is that we work very closely with the Metropolitan Police and also Imperial College and on trying to procure locally and more effectively together. But it seems very stupid to me that we've got 3 different contracts with the same supplier. Now that doesn't make sense to me. So hopefully this, next year we're going to work together, and also with our friend Richard from the use of the universities, because that doesn't make sense for the taxpayer.
Yeah, I think one of the potential advantages that outsourcing can deliver is economies of scale. So I think that's where the collaboration, notwithstanding some of the issues that Bill's talked about that you can lose sustainability, but if you can get collaborative purchasing, then you, in fact, are counterbalancing one of the main advantages that the big contractors can bring to the party. But these are very big organisations. I mean, Compass Group operates over, I think it's 80 some or 90 different countries, so they've got huge resources that they can bring to play. And one of the things that I think they can offer, and Richard alluded to that, was they can offer capital investment. I mean, effectively, it's a private investment, a private finance initiative. And that's the way that they got the contract at Oxford Brookes that Jane has seen. They actually spent a lot of money that the university didn't have on upgrading the facilities. And I guess that we're going to enter a time when there is capital scarcity. And I think that is a potential vulnerability for public sector caterers, that you can find it very difficult to get the capital to expend, whereas a big contractor can actually see this as an opportunity. Naomi Klein, who wrote No Logo, she's written her latest book is Disaster Capitalism, and it points out all the ways in which when you do get problems and difficulties, there are many big corporations out there that actually have got tremendous resources and will try to create advantage for their future growth. And there's no doubt at all that the big contract caterers do see the public sector as being the big growth market that's left. Business and industry contracts are just churning round according to the food programme, whereas the public sector contracts are there waiting to be grabbed, and they're new and they're incremental business. So I do think that you need to be realistic about the advantages that contract caterers have got, the natural advantages because of their size and what they will try to offer and persuade local authorities and others that they should do business with them. Another question? Thank you.
Oh, hi, it's Susanna McWilliam again from Cardiff University. We've talked a lot today about food, very importantly, but also I just wanted to highlight the role of food service and food service quality when it comes to sustainable food systems. Some of my own research has shown in hospitals in Cardiff huge volumes of food waste that could be quite linked to poor standards of food service. And I wondered how much those kind of issues could be included in a debate on sustainable food systems.
Well, I think there's been a lot said about hospital food waste. And I think you've got to, again, bring some common sense into the argument, because if you're ill, you're not going to eat. And it's very difficult for the caterer in the hospital to know who's going to eat and who's not. And I think there's a lot of statistics saying there's a lot of waste of food. But in my experience, if you've got a 30-bedded ward and 3 patients don't eat, that's, 10% of your food waste. But in fact, it may not be. It may be just a bit of food on the plate or something that can be used, And I think we've got to have some common sense about wasting food. But there again, there is a lot of waste that can be reduced. And what we've done at the Royal Brompton Hospitals, all our food waste now goes for composting, which is very useful for me because we weigh now our waste. So we know exactly what comes from the patient, and that's very interesting because people who've got involved in the composting, it's been something that the staff have enhanced, and everything is weighed now, and there's an interest in it, and of course that's reduced my wastage. Our wastage now is 2 or 3%, where it was 6 or 7. Just by doing something that to manage waste, you can reduce it quite quickly. And I think you need to know what's happening with your customers. If you're on the ward and you're looking at who's eating, or you're looking in your restaurant or your university, you get to know who's eating what and what's being wasted. And I think it comes down to supervision and management of that. And that's why I'm employed for by the Trust.
Has anybody got experience of technological food systems, such as one of the things that was said this morning was about reducing the gap between when patients were placing their order for food and consuming it.
Yeah.
And I think Steamplicity was mentioned, which I believe is Compass
It
Group,
is Compass.
Yeah.
where it's based around cook chill and regeneration. And I don't know what the sustainability evidence is about those systems. I think it's an area of research that that could well be undertaken. But so has anybody out there got anything they could share with us about technological food systems and reducing food waste through narrowing the gap?
I think not a technological innovation, but organisation. I came across a local authority. This is to do with schools catering. Was looking at the issue of restricted choice on menu, and they were doing it purely as an efficiency issue. I was pleased to see it because food waste is, as has been alluded to, an extremely significant sustainability issue. In fact, probably if you can reduce your food waste, that's one of the most significant things you can do in sustainability terms, because there's a huge amount of resource used to create that food. I think the restricted choice menu issue, whilst it had been introduced, as I say, purely as an efficiency measure, was reducing waste and reducing cost, because instead of having to produce several meals, a significant proportion of each of which was wasted, they were finding only one meal being prepared. Children had less choice, which is not necessarily a bad thing with certain age groups, and ultimately a win-win situation for the local authority's point of view, i.e. less hassle, because they were creating fewer dishes, so they could actually make staff savings, less expenditure on actual ingredients, and less waste. So I think that was an interesting approach, but I don't know how how rigorous the
that really works in the health
was.
service, really, because if you've got a very small budget and you have to stretch it for so many choices, at the end of the day, that choice is inferior. So what we're saying is to reduce the choice, reduce perhaps the meat content, which is the most expensive part of your menu, and we all need to do that because of the healthy eating and that sort of thing. So you're going to, at the end of the day, if you reduce your choice and give somebody what they want, I mean, if at the moment we have to provide a vegan, a vegetarian, an ethnic, sort of kosher meal, halal, and Uncle Tom Cobley and all, well, my £3.90 is stretched too far. What I would like to do is to say, right, everybody today is going to have sirloin of beef carved on the ward, and I can tell you that everybody will want them, or 70% of the patients will want it. So it's actually saying we give them less choice, and I agree with that, but give them a better quality meal. And that's what I think the key is.